Okay. Hello, I'm Dr. K, and this is Plastic Surgery One-on-One. Today we'll be talking about blepharoplasty. Blepharoplasty is a long word that basically means eyelid surgery, or work on the skin of the eyelid. And what we're going to talk about today is upper blepharoplasty and how you know when you need it, how it can be fixed, and the best procedures. So first of all, what's the problem? What do people complain about when they don't like their eyelids? First thing they usually say is they look tired. Their friends may comment on that, or they may see it in the mirror. The other thing that people see is extra skin across the crease of the eyelid. This is called hooding. Sometimes this can be very mild, sometimes this can be severe. When it first starts to show, what usually happens is a woman has difficulty applying her makeup because it gets crinkly and creasy in there, and there's no crisp fold to put the makeup on. The reason this happens is that the eyelid skin is the thinnest skin in the body. As a result, it ages first. It stretches out and can show crinkliness and creases, especially in the upper eyelid. Sometimes there's a component from the brow loosening up and dropping down, but that's a topic for another day. We'll stick to the eyelid first. So what's the problem? The problem is extra skin that's stretched out in here, and sometimes there's actually some bulges because there are fat pockets underneath the skin and underneath the muscle, and the most common bulge is right there at the side of the nose, and people can sometimes notice that it's very full there, and that's another problem that we see in upper eyelid surgery, that we have to go after this fat pad and remove it. So the anatomy of the problem is basically too much skin that is stretched out and is hanging down. Occasionally it can even hang down to the eyelashes and be very uncomfortable. And the second level of the problem is sometimes there's extra muscle that has stretched out underneath there because the eyelid muscle forms a ring around the eye, and sometimes that muscle stretches out. And the third part of the problem is fat. There are a couple of fat pockets underneath the muscle that protect the eye. The skull is very hard, the eye is very soft. These fat pockets act like shock absorbers, and these shock absorbers protect the eye. As people age and the skin loosens up, these fat pockets can bulge out, especially in the upper eyelid near the nose and across the lower eyelid, which we'll talk about later. So the problem is the extra skin, fat, and occasionally muscle. The anatomy is stretched out skin, stretched out muscle, and fat that is bulging out. So what's the solution? The solution is a blepharoplasty. Once these problems start becoming noticeable, there's no cream that can take care of it. There's no beauty regimen. Surgery is basically the best option. Occasionally, a treatment called thermage, which is a non-invasive radiofrequency treatment, can shrink up the skin, but that has to be determined on an individual basis. So the way the surgery is done is we mark out where the natural fold is, where the natural crease is, and everyone has one. They're a little bit different in Caucasian versus Asian people, but there's always some type of crease, and we actually pinch how much extra skin there is and draw that out. The patient is sedated. Occasionally we do these under a general anesthetic if we're combining it with a lot of other procedures, but usually this is a local with a little sedation, and then the local goes in here. After a couple of minutes, it's all ready to remove. So this part of the skin is removed. That allows us access to either remove just a little bit of muscle to clean that line up, or just open up the muscle to get at this fat pocket, which we gently tease out and then remove. The final step of the procedure is suturing, and we close this up with a very tiny suture. I usually use a dissolvable suture, so it doesn't have to be taken out. It dissolves in about a week. If you have sutures that can be taken out, sometimes they can be a problem. Dissolvable sutures work excellently. Downtime for this surgery is about a week. It's not a week of discomfort or even that much swelling or bruising, but some people do swell, some people do bruise. The stitches are in for about a week. So most people take about a week off of work so people aren't asking them questions about their procedure. As far as risks to this procedure, the main risk is one of a poor scar, which is extremely rare in eyelid skin. The eyelid skin is the thinnest skin in the body. As a result, it generally heals the best. Occasionally there can be bleeding afterwards, which can either be bruising. Very, very rarely people can have severe bleeding, but that's usually associated with medical conditions like bad hypertension or diabetes, things like that. The average person has minimal risk from this surgery. It's one of the most common surgeries. Upper eyelid aging is the first sign of aging in young people because it's the thinnest skin. It shows the wear and tear the first. Some people may need eyelid surgery even in their 20s. Every person is different in their approach. This is a diagrammatic, basic approach. Some people may need more skin, some people may need more fat, but this gives you the basic idea of what an upper blepharoplasty is. We'll be talking about lower blepharoplasty and brow lift on different episodes. Thank you for watching. This is Dr. K. Don't try this at home.